for the session. Welcome to you, sir.
Okay, then. The next is about Kshudraroga. अतः Kshudrarogachikitsam व्याख्यास्यामः यथोवाचमुगान्तरन्तरिः तत्र अजगलिकाम् आमां जलोकभिपचरेत् शुक्तिश्लुग्नि यवक्षारकल्कैश्च आलेपयेद्भिषक् श्यामा लाङ्गलकी पाठाकल्कैर्वा अपि विचक्षणः पक्वां रणविधानेन यथोक्तेन प्रसादयेत्. Now, the Ajagalika, even in Amavastha, Sushruta suggests about the use of Rakta Mokshana and then application of lepas which are having irrigation properties like Kshara or Shukti, Samudra Shukti and so on. And then the other irritant substances like Langalaka, Shama, etc. And then once it becomes separated, drainage is suggested. But in a case of sebaceous nevus or any such macular lesions, the current protocol would be to use retinoid ointments or steroids. But my prescription in these conditions would be Sarivadhyasana. The protocol of Sushruta, like the Pachana and the drainage, may not be required and it may result in more scars in the present day situations. In the present day situation, I may not prefer to go for the suppuration rather, and the better treatment would be the internal administration of the Rakta Drishtihara Dravyas like Sarivadhyasa. That's a better option than really the other treatment. Of course, local treatment like retinoid ointments can definitely produce a change in the outcome. Then another set of the diseases which are produced due to inflammatory pathologies, their andhalaji, evaprakhya, panasim, kachapim, tada, पाषाणगर्दभं चैव श्वेते पूर्वं श्वेते नियोजित मनःशिला ताल कुष्ठधानु कल्कैः प्रलेपयेत् परिपाकगतानि भित्त्वा व्रणवत्समुपाचरेत्. There again, in all these conditions like Amdharaji, Evaprachya, etc., Sushruta has suggested the treatment with the again same protocol of Swedana, then Lepana, and then the drainage. But from the current protocol point of view, all of these are different degrees of granulomatous inflammatory pathology like cystic acne or evaprakhya or panacea or non-inflammatory pathology like neurofibroma like conditions. Pashanagardhava is again a swelling of the parotid like the myxoma. The approach to the treatment would be different because the basic pathological livelihood pathology and the course of the disease are different. Andhalaji and Kachapi, I would consider them as the granulomatous lesions. And current protocol, of course, is antibiotic and carotenoid ointments. But my prescriptions in such conditions would be Kshudrarogachikitsa or Khadir Arista or Gandhakarasayana. Then, in case of evaprakhya or panasi, that type of neoplasm, rather benign tumor pathologies, there is virtually either no intervention or if at all there is a need for that, then a surgical intervention. There is no question of medical management in these conditions, either in a neurofibroma or in case of dermoid conditions. Medical treatment has virtually very little role. It has to be surgical treatment. In case of myxoma of the parotid gland, again, surgical exploration may be followed by, if necessary, the chemotherapy may be required in such conditions depending upon the histopathological report. So, the present approach would be based upon the real course of the disease which we assess, and the protocol of suppuration and drainage may not be very apt treatment in the current situation. Another set of the granulomatous lesions are Vivrtam, Indravritam, Gardabhim, Chalagardabam, Iribelim, Gandhanamim, Kaksham, Vispotagam Sada, Pittajasya Visarpasya Kriyaya Sathayen Pishaka, Ropayet Sarpisha Pakwan Siddhera Maduroshadi. Another set of the granulomatous lesions which present with more of inflammatory signs, and there could be even some sort of exudates, liquid exudates present here. Maybe a granulomatous with some certain mixed conditions, or there could be some foreign body reactions, etc., where the tissue reaction is more. They are of different degrees, and so these pathologies we have discussed in the Nidana, Kshudraroga Nidana. And the name would be based upon the size and appearance, like Gardhabi, Jalagardhaba, all that would be depending upon the same extent of the infective lesions and extent of the tissue damage based upon these different names are given. So from the current point of view, we can put into a gamut of infective pathologies, either with the chronic granulomatous reaction or maybe bit more moderate subacute reactions as such. Now in these conditions, Sushruta suggests the Pittaja Visarpa Kriya, Pittaja Visarpa Kriya, where Shitavirya Dravyas are used and Ropana is done with the Madhuroshada surface. In the present prescriptions, present day situation, in all these conditions, if there is a accumulation of the pus, surgical exploration may be necessary. Or if there is a suspicion of foreign body, surgical exploration may be necessary. And if there is a cystic membrane, like a membranous lesion, curating also may be necessary. But beyond that, after the exploration, surgical exploration, and then the beyond that, the my prescription would be Kshudrarogachikitsa, and the duration of the treatment would be quite long as such. So it's something like what Sushruta has suggested, like where you have to remove that exudates, clean, and then remove the healing. Then chippam mustambanasaktam utkritya sape bhishaka chakratalena cha abhyasya sadchurnena churne bandhena upacharitya enam ashakyam chagnenadheta madhuroshan siddhyana tadasthailen ropeti kunakhe vidhirapyeshah karyo hi bhishja bhavet. The kunaka and chippa, again in the Nidana we have discussed about that. A nail bed pathologies, either which is produced due to trauma or ingrowing to nail conditions. And once there is a accumulation of the pus in an acute condition, it needs to be drained because it is quite painful. And then once it becomes the pus is drained out, the next part is nail bed excision is required. Nail bed excision is the other option of the treatment. Then followed by, of course, our usual treatment for the vrana like Kshudrarogachikitsa. But nail bed excision is the maybe the more definite treatment to prevent further accumulation of the pus. Of course, in a patient with these nail bed pathologies, systemic involvement also has to be ruled out, like diabetes mellitus or so on, which may require a specific treatment. Then Anushayi, Upacharayad Anushayim Shleshma Vidradhi Bhishaka. Anushayi, as we have discussed in the Nidana, it's about the cold abscess conditions where the inflammatory signs are lesser and there could be a thick membrane which separates the pus or exudate from the other region. And in these conditions also, the option of the treatment would be drainage or excision. Drainage if there is not much of a thick membrane, excision if there is a thick membrane like structure, then it has to be excised. And then follow-up of the treatment would be depending upon the culture as suggested as such. If it is a tubercular pathology, anti-tubercular treatment may be required. But follow with that, we can manage with our drugs like Kshudrarogachikitsa and as such. Then Vidarika is again a suppurative condition where there is a deep-seated abscess, Vidarikandavata, like saying. So from the current point of view, it's again a deep-seated abscess. And the treatment would be Vidarikam Samabhidya, Srinam Vimulaptilepayat, Naga Vrittika Varsha Bhu Bilu Mulehi Supeshidehi, Vranabhavagatayam Chakritva Samshodhana Kriyam, Ropanatham Hitam Tailam Kashayam Srihishtam, Pracha Nerva, Jalokobhi, Savya Apakwa Vidarika, Ajakarne Sapalasha Mule Kalkehi Prelepeta, Pakwam Vidarishastrena, Patola Pitiman Deoho, Kalkena Tilayitena Sarpel Mistrena Lepeta, Bhakta Kshiravukshasya Kashayi Khadirasya, Vranam Prakshalayat Shuddham Tadastam Ropayat Punaha. Now, in all these, it's the same protocol as in case of the Shofachikitsa, Vrana Shofachikitsa in the Shastirupakram. Initially, you will be trying to prevent that the inflammatory pathology by either Samshodhana or Lepana or Raktamokshana. If it results in suppuration, then the drainage and the administration, this drainage and the whole promoting the healing. In the current protocol also, it's the same treatment like drainage and antibiotics are the other options of the treatment when it is deep-seated and if the patient has more toxic symptoms. If there are not much of a toxic symptom, our usual prescription like Khadira would be enough. But drainage is essential. In all these conditions where there is accumulated products of exudate, and particularly when they are deep-seated, an effective drainage is necessary, and all that the variation will be the approach to the drain for the drainage depending upon the anatomical location. Then Medorbuda Vidadena Sadir Sharkararbuda. Sharkararbuda is a calcific tumor-like conditions where there is a consolidation or lichenification of the tissue in case of a sebaceous cyst. And naturally, the treatment would be surgical excision. And Sushruta also suggests about in the Medorbuda Chikitsa, the basic protocol is the excision, and the same is true even now. Then Kachum Vichachikam Pamam Kusavatsum Pajare, the lepascha Sasare, Sikta Shatahwa Gora Sarshapehi, Vacha Darvi Sarshapirva Tailam Vadaktamalakam, Sara Tailam Abhyange Kurvita Katuke Shradam. Now, Kachu, Vichachika Pama are different types of the irritation of the skin. Either it could be simple scabies-like conditions where there is a mild infective pathology, Vichachika eczematous pathology. Pama also is a fungal infective lesions, which we now consider them. In all these conditions, because they are very superficial and chronic infective pathologies, or maybe there could be a hypersensitive reaction, the treatment protocol suggested by Sushruta is a local application of lepa and then taila application of the taila. But I would prefer now would be Kshudrarogachikitsa in all such variables like Kshudrarogachikitsa, Lagasuta or Gandhakarsayana, Lagasushikhara or Gandhakarsayana, Manjishtajikwata or Khadirajishta occasionally. Vilechana can help in such chronic conditions because all these conditions are chronic, and if the medical treatment doesn't produce satisfactory results, then Vilechana could be one of the options. The next of the condition is Padadari. Padadariyam Siram Vibha Sweda Abhyango Prayojayata Madhuchistausa Madhya Sadhya Churna Prasehi Kritaha Yavahva Gairikon Mishrehi Padalepa Prashasve. Padalepa is suggested in case of the cracked foot. Now, in the present day situation, of course, the same is absolutely true. What I would deal with would be in the patients who have these kinds of cracked feet, the special care is taken about the local hygiene, depending upon the occupation of the patient or the lifestyle, and then Triphalakvatha, cleaning with the Triphalakvatha could be quite useful for the cleaning purpose, and then say Madhuchista or beeswax or such the softening agents, humidifying agents could be applied over the area. Internal administration of Kshudrarogachikitsa can be quite useful, and as we have discussed earlier, in case of this cracked foot, one of the common causes is a hypersensitivity to plastic or other chemicals. So if the patient is using a plastic footwear, that has to be avoided. Of course, the other disease conditions like psoriasis also have to be ruled out, and in the psoriasis-like condition, the treatment protocol could be slightly varied. Padam Sikwa Aranalena Lepanam Hi Alasehridam Hitam Kalki Krite Nimba Tila Kasi Sa Alehi Sasaindavihi Laksharaso Abhayavapi Karyam Syadraktamokshanam Siddham Rase Kandakaryaha Tailam Vasarshapam Hidam Kasi Sarochana Shila Churnaliva Pratisaranam. Alasa is also a similar condition like the cracked foot where there is a pus formation, infective conditions, and in that condition Sushruta suggests about cleaning with Aranala. That's a acidic substance, low pH substance is used for cleaning. Then lepana and the application of the kalka, raktamokshana and sarshapataila. Of course, the protocol would be same whether it is infected or otherwise. In a case of cracked foot, the same protocol as we have discussed earlier could be useful. Then kadara. Utkritya Dakha Snehena Jayat Kadar Samyakam, in the cords and wards of the lesion, Sushruta has suggested about excision and Agnikarma, cotton. Of course, in the present day situation also, many people prefer to use the similar protocol like excision or cautery, but it depends upon the type of the lesion. If the cords and wards are of infective origin, like viral origin, and there are multiple ones, it's better not to intervene. Intervention can often result in recurrence or maybe a wider one. And half-hearted attempts like even application of Kshara or any other even cautery and so on, which is very practiced, also can be have unpredictable result. A better reasonable option would be clean with the warm water or Triphalakvatha regularly. With that warm would help in softening that keratin tissue, and gradually it may become softer and the symptoms could reduce and the skin may recover normal. The internal administration would be Kaishora Arogyavardhini Sarivadhyasava. Then Indralukte Siram Murthi Stigda Sinasya Mokshedu Kalkehi Samirjehi Dishyat Shila Kasi Sutukhehi Kutan Nata Dal Kalkehi Lepanam Prashasre Prachayitva Avagadham Va Gunja Kalkehi Muhurmuhu Lepe Rupashantyartam Kuryadva Prasayanam Marati Karamira Agni Nattam Maravipachitam Tailam Abhyanjaneshasam Indraluktapaham Param. Khalitya and Indralukta, these are the two conditions. Khalitya is also mentioned in the other chapter later on. So that hair loss, alopecia of android alopecia can be considered as Khalitya, which is beyond the protocol of the current treatment. And Indralukta is the spotty lesions of hair loss, like alopecia areata or maybe pressure induced alopecia, friction induced alopecia like conditions. In these conditions, the treatment could be possible and the outcome can be predicted. And the treatment suggested by Sushila is Siravyatha over the Murdha, over the scalp, which I don't know, I have not tried that, but it could be one. And then local application of irritant substances like Maricha, Kasi, Shila, etc. Or Prachana, Raktamokshana with the Prachana also is suggested as another option. Or local application of Taila also is suggested. In case of alopecia areata produced due to the fungal infection, where the hair follicles become, hair shaft becomes brittle and then there is a loss of hairs. In these conditions, my prescription will be Kaishara Gulgandhakar and Khadirarishya, which can give you a somewhat dependable result. Whereas in other condition like the android alopecia, virtually medical treatment may not be of any use there. Then Arumshika Shrute Rakte Seje Nimbavarina Dishyat Saindhava Yuktena Bhativishthara Senatu Haritala Nisha Nimba Kalkerva Sapatology He ST Nilotpala Eranda Markvairva Pralepeti Indruptabham Tailam Bhyangecha Prashasire hair folliculitis, where the hair follicles become infected, the outcome would be poor. Most of the times it becomes resistant to all sorts of the treatment, and many times even if it reduces, subsides once, it can recur quite frequently. So it's one of the troublesome disease conditions, folliculitis. And instead of trying what Sushila has suggested, like the Lepa as such, I would be preferring to advise the patient to maintain the hygiene, maybe local cleaning with some kashaya, maybe Trifalapada kashaya, Trifalapada, or simply the warm water. And Kshudrarogachikitsa Khadirarishya given internally can produce some change in the outcome. Symptoms can reduce, but the outcome would be poor. What Sushila has suggested is Raktamokshana and cleaning with the Nimba Kashaya and local application of Haritala Nisha, etc. And our Taila, the same which is suggested in Indralukta. Then Siram Daruna Kevidhva Snigdha Srinasya Murdhani Avapidam Shiro Bastim Abhyanganja Prayojeta Kshalane Kodravartrana Kshartoyam Prashasire. In case of dandruff, Darunaka is dandruff. Sushila has suggested the Siravyatha over the scalp, and Avapidanasya and or Shirobasti Abhyanga, local application of these, and cleaning with the Kshara Jala, alkaline fluids. Now, as far as the current protocol of the treatment and as such, the dandruff is one of the very common troublesome condition, and most of the times the cause for the dandruff is so-called anti-dandruff substances, so-called anti-dandruff shampoos and so on. They themselves will produce more irritation, and when a patient comes to me with a dandruff, my first advice would be to not to use such irritant substances, because basically dandruff is due to fragility of the keratin tissue over the surface, and most of these anti-dandruff protocols, they would produce more irritation to the keratin tissue, break down that softened keratin so that the surface looks smooth temporarily. But that continuous irritation itself can stimulate the keratin tissue to become remain abnormal. Chances of it become normal are lesser, and hence the moment you stop the anti-dandruff shampoo, there will be aggravation. Instead, simple coconut oil and soap could be much better to keep the hygiene, and internal administration of Kshudrarogachikitsa Sarivadhyasa could be one of the useful protocols which can produce a treatment. Uparishtat Prakshami Vidhim Palitanashan. Graying of the hair, the treatment is suggested in Chikitsasthana later as such in Sushruta, but from the current point of view also, there is virtually no curative management from medical point of view. All the management would be cosmetic, like you may apply the different coloring substances. Then Masurikayam Kushtagna Lepanadi Kriyasta Pittas Kleshma Visarpokta Kriya Balasamprashyate. Masurika, the chicken pox like conditions, I would not prefer the lepa as suggested by Sushra. And the treatment would be, of course, Pitta Visarpachikitsa like or Pitta Jwara treatment, where I would be preferring Mrityunjalasa, Arogyavardhani or Kamadhuga depending upon the patient's presentation. If the patient has more vesicles, then Kamadhuga. If the patient has more of macular lesions, then Arogyavardhani would be preferred. Paripatharikata is another of the substance which can give you a very dependable results in chickenpox like conditions. Then Jatumanim Samskritya Mashakam Tilakalakam Ksharena Prathayitya Vanyana Bashanehi Shanehi. Jatumani, Mashaka, Tilakalaka. These are all the different types of the Nimai depending upon the size. Sushruta has named them with the different names. And in all that condition, Sushruta has suggested Ksharakarma or Agnikarma. But from the current point of view, I would prefer either no intervention or excision. Half-hearted attempts like Ksharakarma or Agnikarma can produce bigger scar and more of cosmetic issues, because after all, in all these conditions, virtually there would be no local symptoms. All that significance would be from the cosmetic point of view, because they produce that visible abnormalities. The treatment is required, and hence the treatment would be from the cosmetic point of view only. Rarely these nemai may be a source for hemorrhage. In that condition too, the protocol treatment would be excision. So either surgical excision with a scalpel or maybe a more finer excision with a laser beam or so on. The other cosmetic methods of intervention could be tried as such. Similarly, another of the pigmentary disorder groups like Netche, Venge, Netche and Venga are the different types of the pigmentary disorders. Again, we have discussed that in detail in the Nidana. Siramokshaha Nilikayam Jishaside Ethanyayam Methabhyasam Ladatya Disirabhyadaha Ghristva Dishyat Tvajam Pishtva Kshiranam Kshiratim Nitam Bala Atibala Yastya Rajinirva Pralepanam Payasya Aguru Kaliya Lepanam was Sagadikam Kshaudra Adya Yuktaya Limpet Ramsaya Shukarasya Kapita Raja Vaneho Kalkam Chahitum Chete. Now, in these hemangioma or the variations of the hemangioma and pigmentary conditions, Sushruta has suggested Sirabhyatha or local curating of the lesion. Skin has to be curated, and application of lepa or then the kalka as such. From the current point of view and maybe from the possible outcome as such, I would prefer to have no intervention in these conditions. Either if patient has to accept it, because it's otherwise not going to trouble anyway except for the cosmetic reason. Then if at all the patient prefers, then it's a cosmetic intervention. Cosmetic interventions now, of course, in the cosmetology, lots of new techniques are coming up to treat these hemangiomas. So any of those techniques, more sophisticated techniques, the whole target is to minimize the scar. So any of those technology which would present with or which would result in minimize the scar and lesser chance of recurrence, they are preferred there. Then Yavana Pidaka and Padmini Kantaka, the different types of the Ekun conditions. Yavane Pidaka Swesha Vishesha Chadalam Hidam Lepanam Tavacha Lothra Indavehi Sarshapan Videhi Kustumbur Vacha Lothra Kusterva Lepanam Hidam Padmini Kantaka Roge Chade Nimbavarana Tenayam Siddham Sakshavdram Sarpit Panam Prarapet Nimba Arakvadeyo Kalkaha Hitaha Utsadane Bhavet. In Ekin with the infective or more protruded hard these core-like substances, or with the simply the granulomatous infective pathologies of Ekin, the treatment suggested by Sushruta is mainly Vamana and local application with the drugs of different sorts. Of course, from the current point of view, when you manage a patient of Ekin, the most important part is about the diet. The spicy food, junk food is the main cause for that issue. and it may result in hormonal abnormalities, and hormonal changes also can be another triggering factors for the Sagan, and in such conditions they need to be considered. And another of the reason is the oily skin, the skin itself having more of sebaceous secretions, and the glands are sweat glands are obstructed or blocked by the cosmetics which are applied. They also can be a cause for the triggering factors. So my advice is not to apply any such gelatinous or sticky cosmetic substances, any sort of that. A dry powder is okay, and cleaning with either Triphalakata or warm water regularly. Diet and hygiene are the most important aspects of the management of egg. Internal administration of Kshudrarogachikitsa also can produce some significant results. Then Parivarti is paraphimosis. Parivartim Grisabhektam Susinam Upanahed Tato Abhyadya Shani Charmacha Anayat Pirayan Manim Pravishte Mano Charma Swede Upanahani Strilatram Pancharatram Vatagni Saranadivi Dadyat Vataharan Bastin Stinthani Anani Bhojed Avapatikam De Devam Yatha Dosham Chikitsakaha. Parivarti and avapatika. Parivarti is paraphimosis, avapatika is a cracked skin, granulomatous, glands penis skin being injured. Now, in these conditions, Sushra has suggested about the manual reduction. Manual reduction is by applying Grita, and then Swedana and Upanahana also are suggested. But from the current point of view, again, the paraphimosis patient who comes early, in the early stage, it's better that you can have a manual reduction. The manual reduction protocol is very important. It's not that the whole lesion is, or the skin is pulled up. Instead, that bulged portion of the paraphimosis has to be compressed so that the fluid will be transmitted to the proximal segment. That band which is formed at the neck, that should not be injured in the beginning, then it may be possible. But if the patient has come later and the fluid has become hardened, or in a case of massive paraphimosis, a manual reduction may not be possible. In such conditions, a better option of the treatment would be circumcision. Circumcision could be a better option of the treatment. Niruddha Prakashe, in the patients who have the phimosis-like conditions, the Sushruta has suggested Niruddha Prakashe Nadiyam Lauhiyam Ubhayatomkim Daravim Va Jatukrutam Grasabhaktam Praveshet Karisheke Basa Madhya Shishimara Varahayoho Chakratailam Tatayajam Matagna Dravya Sanitam Trehat Stulataram Samyak Nadim Praveshet Sroto Vivardhayat Evam Snigdhamannam Jabhojet Bhitva Va Sevani Mukta Subject Sharavakaret Saniruddhagudam Rogam. That's about the treatment of Niruddha Prakasha. That's either the phimosis or the strictures of the urethra. In the strictures of the urethra, even now, the treatment protocol would be exactly as mentioned by Sushruta. That's dilatation. The dilatation is the suggested treatment by Sushruta in Niruddha Prakasha. And the protocol is that you have to insert a nadi, a tubular dilator, which is prepared out of wood or maybe wax or metal, and then it has to be gradually introduced interval of either trehat once in 3 days, and then the whole lumen has to be dilated. In the present day situation too, the protocol is almost similar. Instead of a tubular structure, we may use a rod shalaka, which again this issue we have discussed in the Suprasthana when we discussed about the instruments, surgical instruments there. And but we may not go for the dilatation in a single day within a short duration, may not have that gap of once in 3 days, because you have a facility of anesthesia now, whereas in Sushru's period anesthesia was not there, and hence the dilatation was done at an interval of 3 days, once in 3 days. Now, if this if this fails, then the option would be you have to have metotomy. The incision has to be done, and the meatus urethra has to be kept open. If you consider Niruddha Prakasha as the phimosis, in the present protocol, the treatment would be circumcision. Circumcision would be the treatment. So Niruddha Prakasha could be considered as either as per the description in the Nidana, it looks like the phimosis. But when it comes to the question of treatment, even the strictures also could be considered as a Niruddha Prakasha. So I will not go into that controversy again. That issue of controversy we have already referred to in the Nidana. And the treatment protocol would be based upon the exact diagnosis. Saniruddha is the stricture of anus, and according to Sushruta, Saniruddha Buddha also has to be treated in the same line as that of the Niruddha Prakasha, like dilatation. Even now, in an anal stricture, the dilatation is the treatment, but the protocol outcome is poor, and hence it's considered as a Pratyakhyaya. Saniruddha Rogam, Valmikam, Vanirohinam, Pratyakhyaya Yata Yogam Chikitsitam Athacareta. Saniruddha, Valmika, and Agnirohini, these are considered as a difficult prognosis, outcome is unpredictable, and hence the treatment has to be careful, and you have to inform the patient about the outcome. In Saniruddha Yogya Niruddha Prakasha Kriya, in the Saniruddha same protocol as that Niruddha Prakasha, dilatation is suggested, whereas in Valmika and Agnirohini, Visarpoktena Vijayana Sarya Agnirohinam, as the treatment of Visarpa, infective lesions, that is the same protocol of the treatment. Then Valmika, which is again considered as Yapya or Pratyakshaya Vyadhi, the other options of the treatment is Shastrena Utpatya Valmikam Sharagnibhyam Prasadeta Vidhanena Arbudoptena Shodhayitva Charopeta Valmikam tu Bhavedyasya Nati Vruddham Amarmajam Tatra Samshodhanam Krutva Shonitam Mokshayad Bishaka Kulachikaya Mulesha Kudutyaha Lavanena Cha Arayavadasya Mulesha Danti Mulehi Tatevata Shama Mulehi Sapalalihi Shaktumisrehi Pilapeta Susmik Desha Sukoshnesha Bishaktam Upanaheta Pakvamva Tadvijaniyat Gatihi Sarvaha Ythakramam Abhijnaya Tatashchitva Pradahet Matiman Bhishta Samshodya Dustamamsani Ksharena Pratisareta Vranam Vishuddham Vijnaya Ropayet Matiman Bhishata Sumana Brantayashtiva Bhallataka Manashile Kalanusari Sukshmela Chandana Aguruni Tata Ete Siddham Nimbatailam Valmike Ropanam Hitam Panipago Parishthatu Chidrihi Bhovir Avartam Valmikam Tat Sachopam Syat Varjam Tattu Vijanata. Valmika is very much like the actinomycosis, where there would be multiple sinuses and the condition becomes chronic. Even now, the outcome of actinomycosis and suppurative hydradenitis, the outcome is poor, and the treatment protocol would be either excision and then maybe the specific antibiotic treatment. Prognosis is poor. Sushruta has suggested the treatment as different options. One option would be Shastrena Utkritya, either excision, or another option is identify the tracts, and the tracts have to be excised, which again is practically very difficult, but still that's one of the options which may be suggested. That's Pakvam Tad Vijaniyat Gatihi Sarvaha Yathakrama. Each of the Gati or each of the tract has to be identified, and then it has to be excised and cauterized. The other options are local treatment like Samshodhana, seismic treatment like Samshodhana Vamana or Rakta Mokshana, or local application like Guduji, Lavana, or Lepa, etc., or Taila. These are the different options. In case of actinomycosis, even now the protocol is surgical excision is one of the options, but even surgical excision, because it results in a wide excision and loss of tissue, not a choice of the treatment. And even after surgical excision, recurrence is quite high, and hence generally it's not preferred. Conservative management doesn't give a definite outcome, poor prognosis, and what I will try is Suvarnamalini Vasanta 1 gram per week given for a long duration like 6 months or so, along with the Triphala Gugul Gandhakarsayana, may produce somewhat a moderate resolution in the clinical course, may not be completely cured. Prognosis is poor. Then Dhatryassanyam Shodhayitva Bale Sathya Ahiputana Patolapatra Trifala Rasanjanam Pachilam Pitam Dhudam Nashayati Kricham Abhi Ahiputana Trifala Kola Khadira Kashayam Ranaropanam Kasi Sarochanatta Haritala Rasanjanihi Lepo Amlapisto Badari Tugva Saindava Sanyata Kabala Thajam Chunam Chuna Kale Prayeta Chikitset Muskakachum Chapi Ahiputanam Pama Bada Ahiputana Kachu and Pama. These are all the different types of the dovisit and scabies or teniasis, etc., where there is a genital area infections. Now, in case of pediatric condition, Sushruta has suggested to administer the drug to the feeding mother so that the milk itself would be acting as a medication. Now, this kind of a protocol may not be practicable now as such, and you will have some legal issues also. Again, something which we have referred to earlier when we discussed about the stanya dosha, etc. The other options of the treatment suggested by Sushila is Kashaya, Triphala Kola Khadira Kashaya, and Lepa also is suggested as an option of the treatment. Of course, in the present day situation, the treatment protocol would be again local hygiene is the most important issue, and avoidance of irritant substances. Most of the times, it could be the irritant chemicals which are used, which could be the cause for these. They have to be avoided. Internal administration of Gandhaka Rasayana or Khadilarishta could be useful depending upon the age and condition of the patient. Then Gudabhramshe Gudam Svinam Sneham Piktam Praveshe, the Karayet Gopana Bandam Madhya Chitrera Charmana, Vinirgamartham Vayoscha Sedayecha Muhurmuhu, Kshire Mahat Panchamula Mushikam Cha Antravartitam, Pakpa Tasmin Pachet Telam, Matam Naushad Saintam, Gudabhramsha Midamu Pracham Bhana Bhengar Prasade. In Gudabhramsha or anal prolapse, Sushila has devised a specific obstructing instrument, a gofanabandha, a thick leather piece which can be tied around the anus, keeping an opening for the plates and pieces to pass through. Now, one of the surgical options which are done are options which are quite popular in case of anal prolapse is the Thirsha operation, where you put in a wire ring around the anal margin subcutaneously. Now, the difference would be, now we put that obstructing ring around the anal margin subcutaneously, whereas Sushila had used a banded outside, external, which would be less effective, but less intervening also. Anyway, that's one of the issues. Mechanical reduction and prevention of the prolapse is one of the options which could be quite useful. The other options now are, you have the other options of surgical dissection and correction. Sushila has suggested a specific yoga, the Mushika Taila, as a protocol of the treatment which can be given in internal administration as well as local. During my internship, I have tried this. I have prepared Mushika Taila and administered in a few patients, around 6 to 8 patients. But with whatever the method which we have administered, there was not much of a significant benefit. I have tried locally as well as systemically internally. But it has not given benefit in a limited number of patients. So that doesn't mean that the whole thing is useless or so on. But my experience and my trials have not produced satisfactory results. With this, we conclude the chapter Kshudrarogachikitsa Vyakhyasyamayiti Sushritasaitam Chikitsastanis Kshudrarogachikitsa Nama Vimshodhyayaha. If there are any questions, I will try to answer and then conclude. Right, there are some questions. What is the rationality of specifically Snigdha Agni Karma in Kshudrarogachikitsa? So, see, Snigdha Agni Karma, of course, could be because it's deep located, and for the burning of the deeper tissue, Snigdha Agni Karma is suggested. Sushruta has suggested the Snigdha Agni Karma, but from the current point of view, as I know, as I have observed, any such intervention can produce more scar, and maybe at times it could be resulting in a deeper and bigger lesion as such. So the most important is it's not about the excision which is more important. The important is you have to prevent the recurrence, which is quite difficult in case of the corns and warts. So that's the issue. So you may have to consider that. Then, in spite of these disorders told as Kshudraroga, which is Alpa Hetu, Alpa Lakshana, Alpa Chikitsa, there are many diseases which have a bad prognosis and are surgical conditions. How to understand this? I think in the Nidana Sthana, when we discussed about Kshudra Nidana, I have given that in detail. I have discussed in detail about why that name would be applicable. So maybe I have to repeat, but in brief, it's like I would consider the word Kshudra for that condition which gives either a appearance which is not acceptable or make the patient feel inferior. So either it's a cosmetically visible condition, or it may give a social inhibition to the patient to express about the disease, like the genital areas, lesions. Patient may not express, easy to express. Then cosmetic conditions, many of these pigmentary disorders and the surface lesions may make the patient feel Kshudra, and that's the rationale of naming the condition as a Kshudraroga, not the other way. That's what I would feel, and this we have discussed. I have discussed in detail with the different references during the Nidana Chikitsa. So if you can refer to that Nidana class there, Kshudraroga Nidana, you may do that. Then for Kadar Agni Karma, would you suggest, sir? I have told I don't suggest. I don't do, and I don't suggest that Agni Karma in the Kadara. But there are people who practice and claim that there is a benefit. I don't know. So from my point of view, I don't use that. That's it. Right. So all the questions. Okay. Thank you, sir.